Hi guys, Sid here in the AAFE Training Center. We have this lovely patient in our chair today. So I've been seeing this patient for quite a while now. We have done some cheek on her, some lips, of course, pretty consistent with the tox, which she's loving. She is a big lip girl, so she loves her lips. Tell us a little bit about your lip journey.
Yeah, we've done it a couple times already, and I just want big lips. I had no lips when I first started, so.
So we're getting her there. So this is exciting. We have kind of created, if you want to come on in and take a closer look at her lips, we've really kind of perfected that shape that we're loving. She does suffer from a little bit of the cracks near the oral commissures, so filler helps there. She is someone who gets chapped lips throughout the winter, which of course we're in Cleveland, we all do, but this lip filler will help that, not only with that, big lip goal that she has, but also with the hydration, make them look hydrated, plump, healthy, all those good things that we desire. So we're not going to do a ton of different techniques here. We're really just loving that shape that we already have. We're just going to fill in a little bit of the deficits from here. So you can follow along. I'm going to get her adjusted in the chair slightly. Perfect. Okay, you let me know if you need me to stop it all, okay? She's a really good patient, so I'm not worried. So typically I'll go in. This is her natural kind of Cupid's bow, and we did talk about this a little bit. She's not someone who really wants her Cupid's bow emphasized. She really just likes it more subtle. So I'm not going to go ahead and emphasize that at all. I'm just going to kind of fill the deficit. So little poke. Checking my depth, good depth, and I'm just going to lay a nice linear strut of product. To save her a poke, I'm then going to fan, so I'm not coming all the way out. Going to fill this deficit here. I like my depth. I'm always tenting up to make sure that I still do. Nice, healthy strut, excuse me. A little bit of product followed me out, no big deal. Now you can see that this looks a little firm there, a little dimpled, if you will. No big deal. We are going to smooth that out. I do not like to smooth while I'm filling. I like to wait until the end because the patient will swell and then we won't be able to tell what's what. Another thing, you might have just noticed that there was a little bleb of product at the tip of my needle. I see so often injectors wipe with their glove. We don't want to do that. We want to stay sterile. So I didn't want to see that. I just gave it a flick. Or you just go ahead and continue injecting. The filler's going into the body of the lip anyway, so it's no big deal if it's there. Here I am coming a little bit more laterally towards the oral commissure. I feel a little deep there, so I'm just going to adjust. Keep in mind this patient does have lip filler in here already, so we're going to feel a little bit deeper than we might on a patient who doesn't have any lip filler. Good. All right, I'm coming around to the other side. I'm going to have her turn just slightly towards me. And you can see how much more hydrated this side looks. We're just kind of filling in those deficiencies. Work my way up. Good depth. And a nice retrograde injection. That'll keep us safe. And then we're going to fill the body of the lip right here. Good depth. I'm avoiding the wet dry. We don't want to place filler in that wet area because it won't metabolize out. We want to stay within the body of the lip. We don't want any of that migration out. Turn away from me slightly. Now this is a great patient. She's not bleeding a lot, which of course some of us can't help, but avoiding alcohol, avoiding caffeine, sometimes taking arnica, not taking any NSAIDs. Look, I'm going to jinx us, but not too much bleeding at all. This is completely normal. Avoiding NSAIDs and things like that can definitely help with bruising and swelling. We always talk about post-care. So this patient is a pro. We know that, she's not going to drink tonight. She's going to kind of try to stay hydrated. We're not going to manipulate this product at all. We know some, tenderness at the site. A little bit of bruising is normal. But if she has any severe pain, any mottled skin, anything like that, anything that looks alarming, she's going to let me know right away because that is something that we look for. And that might, give us the indication that there is a problem. All right, open for me slightly. We have one site that wants to give us a little bit of a problem here. So I'm loving the way this is looking. Of course, if I wanted to tweak the shape a little bit, I might go in with, a smaller gauge needle backfilled with some of this product so that I can more precisely place the product. But that's not the goal today. I'm just holding a little bit of pressure here to hopefully stop this from bleeding. And I'm going to continue on. All right, open for me. So we had a little bleeding over here, a little bit of a bruise, no big deal at all. We're going back in. I'm just going to lay a little bit of product closer to the vermilion border just to get this area to pop slightly. Good. And now I'm going to move on to the bottom. So I like to change my needle if possible, if it feels like it's getting dull, just because it does provide a little bit more comfort to the patient. This all looks so beautiful. Now, if you'll notice, this patient has a little bit of this soft tissue swelling above the lip. That's not concerning. Of course, that's going to go down. It starts to look a little shelf-like. This patient actually likes the way that her lips look when they're a little swollen, and we talked about that when she came in. Sometimes when you wake up in the morning, or maybe you drank the night before, or you get a little bit of sun, sometimes your lips will end up a little bit swollen, and some people like that look. So that's the goal. We're going to kind of try to get her there with some filler. So I'm moving on to the bottom. I kind of just measure. I'm going to midline, and I'm going to fill this natural tubercle of the lip. Placing a nice, healthy, linear strut of product. And I'm going to do one more, a little bit further back. Every patient is different, so my method changes. It's very patient specific. And bear with me. I'm just going to change my needle real quick. It's nice because most fillers these days do come with 2 needles. So if you need to change, you can. I like to do it just for patient comfort, like I said. And then after, I'm going to tell you about what we're going to put on her lips. We do use Comfort Tox post-care lip kit. The patient goes home with it. It is a nice serum and balm. And it has arnica in it, hyaluronic acid, essential oils. It's completely homeopathic, and it's really nice knowing that the patient goes home with something that is clean and patient specific. So you can see here she has this little bit of a divot right where those 2 tubercles meet. I like to really emphasize that because that's pretty in patients that we can see it in. A little bit of a poke. This patient's doing great. You hanging in there all right? Mm-hmm. This set I'm going to fan a little bit and just fill this body. Good. Now I'm going to fill the oral closer to the oral commissure. Turn towards me, please. I'm going to wipe her just slightly. And I'm going to fill. You can see here where that filler kind of falls off. You can see it's nice and hydrated and plump. And we just need a little bit more in this corner. Always checking my depth and laying a nice, healthy retrograde injection there, and I'm going to put just slightly more. You doing okay? Mm-hmm. Good. And I'm watching that tissue fill. So often we get the question, how much are you putting? How much are you putting? It's not an exact amount. We don't want to place too much in one area, of course. Turn slightly for me. However, you really want to watch the tissue fill. And that's the goal, right? We're not putting exact amounts in any area. I'm going to do one more strut, and then I'm going to make sure she kind of stops bleeding so we can take a closer look. Okay, so here I am. I just have some clean gauze. I'm just applying pressure at some of those sites that we have a little bit of bleeding. And the patient did just say that this fill was not as bad as it had been historically. She's also a great patient, but I was just kind of educating the patient that the pain associated with these procedures is kind of dependent on what's going on. It can change kind of just depending on hormones or, sometimes we're more sensitive than others, especially one side of the face compared to the other. For some reason, a lot of people have one side that is a little bit more pinchy. That is all completely normal. Sometimes people feel like they're having, kind of a day where they're being a baby. It's all, it's all relative. Sometimes it's worse than others. And we just numbed this patient topically with a lidocaine tetracaine ointment. We did not dental block her, so she is doing phenomenally well. Again, I'm just going to hold a little bit of pressure here. I'm loving the way these are looking. I'm going to give them a nice massage, see what we're doing. I did use about 3/4 of the syringe. So we haven't quite used the whole thing, but we'll take a peek and see where we need to add a little bit more or kind of massage. So when I massage, everyone does this a little bit differently, but I like to take a gauze, and I always say I like to roll it like a hot dog. I learned that when I was young. This is hamburger way, this is hot dog way. So I wrap it kind of like a hot dog, and I'm just giving gentle pressure to kind of feel if I feel any obvious lumps or bumps, and I don't. I'm just kind of manipulating that product just slightly, working out any of those little bumps that I feel, and it feels great. And then down here, so right in the middle where I laid a little bit more product, I do feel a little bit of some firm product that I want to work out slightly, but just, you can see, just very gentle pressure. Doesn't hurt, correct? Mm-hmm. Good. I'm going to hold a little bit of pressure there. And this patient is a little swollen, but not terrible at all. They're looking really pretty. All right, so to me, of course, her lips aren't completely closed right now, but to me, my eye is going right here to this bottom right. I think she needs a little bit more product right there. She's a little bit more, has more volume there, so I'm just gonna fix that quickly. One more poke, okay? Open for me slightly. So right here is where my eye is going. Good, and I'm going to do one more quickly. No bleeding at all with that. Now I have some of that balm already. I'm going to give her one more feel, make sure that I don't feel anything that needs to be worked out. And sometimes when you put this balm on, of course you want to make sure they're nice and clean, no obvious blood. But sometimes when you put the balm on, it kind of helps that blood subside, the bleeding. All right, so here we are. I have her all cleaned off. We have that one site who's given us a little bit of a problem, but nothing too big of a deal. I'm just gonna put that there for 1 second while I talk to you about this. So this is our ComfortTox Lips Lip Restore Serum, and you do have to prime it a little bit the first time. So you just keep clicking it, and you'll see that little bubble of product appear. So her lips are now nice and clean. I did all the manipulation I wanted to do, and this is patient specific. So this is gonna go on now. It's nice and clean, never been used before. If the tip gets a little bloody, we can always alcohol it. This patient knows what to do with it because she's used it before, but watch these lips transform. Look how beautiful they are. So we have a little bit of blood on there, no big deal. I'm going to clean them off. Put a nice healthy layer of this on, and then I'm going to follow it up with the balm that comes with it, and these lips are just going to look absolutely beautiful. And here we have the balm. I have it on a little applicator. I just put it on the back of my glove to kind of warm it up. And here we go. She does have a little bit of bruising on this right side where I went in a couple times, but nothing too alarming. Of course, she knows to let me know if she has anything concerning whatsoever. And as always, I will see this patient back to make sure everything is looking okay. I think these lips are looking fabulous. Go ahead and close your lips together for me. Perfect. I might have been a little generous with this balm, but it's looking really nice and pretty. And I'm just going to use a little bit of a gauze to clean up the sides. Pain-wise, you were okay?
Oh, yeah.
Okay, try to rub your lips together for me. Perfect. I know they feel huge. And there you have it. Thanks for stopping by, guys.